To our police department family, I want to begin this video by once again thanking each of you for the excellent work during the long days of tornado response and recovery. I have received numerous emails and personal words of appreciation for all that you have done and continue to do. The recovery process will continue over a period of months in some neighborhoods, and our special attention to these areas will be needed as families rebuild. In the aftermath of the tornado is the COVID-19 pandemic, which has brought unprecedented times for the world, our country, and this city. As you know, we implemented an alternative call response program on Wednesday through which officers can take certain non-emergency reports over the phone. This is to help minimize the spread of the virus. We deployed 80 cell phones across 8 precincts to be shared by each shift. Thanks to the assistance of Mayor Cooper, each officer will soon be getting his or her own departmental issued iPhone 11. We'll begin distributing those to officers at the precincts on Monday and will continue as shipments of phones arrive. Moving forward, it's important to me that we all receive accurate information on the COVID-19 virus, as opposed to some of the absolute falsehoods circulating on social media. We are very fortunate in Nashville to have Vanderbilt University Medical Center and its renowned team of experts. One of those persons is Dr. Slovis, Vanderbilt's chairman of emergency medicine. Dr. Slovis graciously agreed to come to police headquarters to take part in this video by answering police officer specific questions concerning the COVID-19 virus. This information is vital to all of us. I hope that you pay close attention.
So this is a really trying time. And I think especially for police officers, they need to know some important facts. The most important fact I want to relay today is if they're with a patient that they are suspicious of being infectious, or they're going to be in close contact with any individual, certainly if making an arrest and physical contact is required, if they wear a mask and the patient wears a mask, the likelihood of getting infected approaches 0. It's never 0 for anyone, but it approaches 0, and transmission of the COVID virus is as close to 0 as possible. I think the best way to think about this virus, the coronavirus or COVID-19 virus, is to think of it as a flu-like illness, fever, cough. Some patients have had a lot of GI symptoms, weakness, myalgias, overall not feeling right. If you think about when you've had the flu or someone you know has had the flu, those are the symptoms we worry about. There's one problem, and that is it's unclear if people can spread this in an asymptomatic state. There's some suggestion a few hours or up to a day, there may be viral shedding. And so I think just caution is advised right now, but not panic. If you're going to be close to someone you don't know, making an arrest or dealing with a problem, and they're going to be in your face, I think you wearing a mask. And if you're concerned about them, they can put on a mask too. There's one good thing about masks. If they don't get wet, they can be reused over and over. For those of us who work in the ED, we wear the same mask for 8 or 9 hours at a time. So your officers don't have to keep throwing out their masks. They're good unless they get wet, unless they're contaminated by a lot of moisture, spit, vomit. This is a time where I think being more cautious is better. If you're going to be making an arrest, if you're going to be close to someone other than someone you know very well, wear protective gear, especially a mask, especially gloves. I don't believe you need to get gowned unless you're working with EMS and there's a plan to go into a area where you know someone's at high risk and law enforcement is needed to support EMS. In general, a mask and gloves are all you need. If you believe the patient is going to be spitting at you, then a mask with a face shield is the way to go. If you're going to be entering a residence, in general, if you're just wearing a mask, you're protected. If you're going into an area where you believe there's a high risk for coronavirus, there are people sick, or you just don't know and you don't like the feel that you have, then bring an extra mask, and as you approach the individual you need to, have she or he put the mask on too. Once again, in the ED, our mask, the patient mask, we know that our risk level approaches 0. During this pandemic, if you feel like you have a cold, you ought to assume you have coronavirus and get tested. If you are feeling like you're getting the flu, fever, chills, you have this sense of heat, you feel really cold, if you're coughing, if your GI tract is not working like it should, and you feel sick, you need to get tested. You should not come to work. And be aware, if you do, then if you're riding with someone or in a car, that car is going to be a vehicle that can contaminate the next person and transmit the virus. Be cautious. At the same time, I also want to say, if you are asymptomatic, you are fine to be at work or in a car with a fellow officer. Yeah, this is a time for us to be aware that by being too close to people we don't know, that there is a risk, a small risk every time. And so as long as you're smart about what you touch, as long as you're smart about where you are, we should do well. Whether there's an epidemic or pandemic, whether Nashville or any city is overrun by this virus, being careful should protect us. Gloves, mask, shield your eyes with either glasses or a face mask if you're in a high-risk situation. We don't need to fear each other as long as we're careful, and I'm optimistic we can beat this.
I am thankful to Dr. Slovis for his long and continuing support of our police department and its officers. In the days and weeks to come, we will work to keep you informed of the evolving responses by our police department and our city to the COVID-19 virus. Thank you for watching, and thank you for all that you do to enhance the safety of Nashville's families and its visitors.